Abortion rights advocates are planning major rallies in Capitol Hill to fight the House bill's anti-abortion amendment. Democratic Congresswoman Debbie Wasserman Schultz is working to get that measure stripped out in conference. First of all, it's not even clear that it's going to get through the Senate side as well. So we've got a number of battles to come. But let's talk about the abortion amendment, because it's very clear that the White House, while saying that it is against this and wants to preserve the status quo, doesn't seem as though the president is really willing to fight for this one.
Well, I think that remains to be seen. I feel quite confident that both sides of this debate within our caucus have the overall goal of making sure we can pass health care reform and preserving the status quo when it comes to abortion coverage. And I really believe strongly that as we move through the process, as the bill moves through the Senate, that we're going to be able to find language that will satisfy both sides and will preserve the status quo. We were very close to doing that in the hours leading up to the vote last Saturday, and I feel confident that we'll get there.
What do you think happened? Was this a case where Speaker Pelosi just felt she had to keep the ball going down the field and she could not take a stand, despite the fact that her own principles, her own positions have always been to be in favor of keeping the status quo and of preserving the right of choice?
Well, I think this was a difficult vote for all of our pro-choice members. I can tell you just from my own perspective, I would imagine this is the same thought process that the Speaker went through. We had competing principles. I mean, I've spent my career knowing that I should never cast a vote that compromises my principles, but you had two competing principles in the same bill, and in order to move forward on covering everyone in America and making sure we can provide security and stability for those who have coverage and bring costs down, ensuring that health care reform moved forward, knowing that we're going to be able to continue to work on this language, was the principle that we felt needed to win the day.
One of the issues that critics are bringing to this is that money is fungible. We've heard that on a lot of these talk shows, that you can't have a government-assisted, government-subsidized plan and say you're going to use your private money to buy, elective abortion coverage, because all this money is in the same pot. In the new Washington Post ABC poll, 61% say that if this elective coverage is bought with government assistance, it should not cover elective abortions. The support jumps 21 points to 56% if insurers are using only private money. But the question remains, how do you segregate that money when you're in these public exchanges, as are contemplated in the new bill?
There is a way to segregate that money, and there are states that do that when it comes to covering abortions with state funds versus the federal funds that are not available to cover abortion coverage. At the end of the day, the language in the health care reform bill right now is a significant restriction beyond a woman's current rights. It goes beyond the Hyde Amendment and further restricts a woman's right to make her own reproductive choices simply because she has some money that she needs to assist her in purchasing health care insurance. And that's much further than either side says we're intending to go, and we need to go back to the drawing board, and we are in the process of doing that to make sure we can come up with more neutral language that preserves the status quo.
Just as a tactical matter, what is your notion of what's going to happen on the Senate side? Because you have a much better chance of stripping this out in conference if the Senate has not approved the same language.
Well, this is not about stripping the language. It's about sitting down with both sides of this argument and working out language that makes everyone comfortable that we are actually preserving the status quo, which would maintain the Hyde Amendment, which has been in policy since 1976 in the United States, where federal funds wouldn't go to cover abortion, but making sure at the same time that women do have the right to use their own funds to have that choice.
Let me ask you about the new mammogram guidelines, because there's a lot of confusion out there and some suspicion as well. We've been talking so much about bending the curve on health care costs. There are a lot of people who are saying, now wait a second, we've been told one thing, all of a sudden we're being told another. It would save money to not have as many mammograms for women in their 40s. So therefore, a lot of people are going to say, wait a second, you're not doing this for reasons of science. Dr. Nancy Snyderman has been emphasizing over and over again that this really is solid science. But what do you feel? You were someone who discovered your own breast cancer in your 40s.
Right.
What about not having mammograms, not recommending mammograms? Today, the American Cancer Society is disagreeing with that study.
Right.
So what are people to think?
Well, these recommendations are very disturbing. They may consider science, but they don't consider the fact that you have a drop in the in the death rate since we have been encouraging women over 40 to get mammograms, and that early detection has increased as a result of instilling in women the notion that when they turn 40 years old they should get a mammogram. And what the most disturbing aspect of these recommendations is the confusion that it's going to cause women potentially that would make a decision just not to, they don't know which recommendation is right, and they just would put off a decision on having a mammogram, and as a result fewer breast cancers would be detected and more women will die. We know these recommendations, if women 40 to 49 decide not to have a mammogram, that more women will die, and writing off women in that 10-year period is totally inappropriate. And that's why the American Cancer Society, Susan G. Komen Foundation, and the cancer advocacy groups have all come out against these recommendations and urge women to continue to have a mammogram if they're older than 40, and most of all, consult with their health care provider.
Well, what would you like to see done? Because Kathleen Sebelius obviously should have a role here, and others in the federal government, Congress as well, the relevant committees. Because what if insurers now decide that they're not going to reimburse? And what if doctors don't prescribe?
That's really the biggest concern, is that in this country, and that's why healthcare reform is so important, we've been trying to turn the healthcare system on its head from a sick care system to a prevention system, and this is really an obstacle to doing that. I've been in contact with the Assistant Secretary for the Department of Health and Human Services. They're just saying they're simply studying these recommendations now. They have concerns as well, but we can't allow the insurance industry to continue to drive coverage decisions which drive health care decisions. So yes, there is a risk that the health insurance plans of America will stop covering mammograms for women older than when they turn 40, and as a result you're going to have more women die, fewer women catch their breast cancer. The bottom line is that we need to make sure this does not become accepted practice by the U.S. government, and that insurance plans do not change their coverage decisions.
Is Congress going to do something? Do you think there should be hearings? Are you going to speak to the Speaker?
Most definitely. I think we need to make sure that we explore these recommendations. They're very disturbing. My understanding is that they're based on no new information, no new studies, simply a re-examination of studies that were already out there, and we can't turn literally 20 years of recommendations that have helped women detect breast cancer early and brought the death rate overall for women down when it comes to breast cancer. We can't turn that upside down and discourage women from being able to be familiar with the look and feel of their breasts. That's, at the end of the day, getting women to focus on their breast health is the most important thing. And the presumption, Andrea, that this task force is making is that women aren't going to be able to handle this information, and that healthcare providers aren't going to be able to help women make a decision about the information that they do get when they're 40 to 49 years old.
I'm so glad that we had you on to speak out.
Thank you.
It's really good to see you, Congresswoman.
Good to see you, too.
Thank you very much.
Thanks, Andrea.